Hi guys, so this video is on acute outcomes of acute inflammation. Acute inflammation is a process, right? And every process has an outcome. It ends into something, and that's what happens with acute inflammation as well. It has certain outcomes. It ends up with something. Now, a process can have various outcomes depending on the complexity of the process and what all factors affect that process. So, similarly, acute inflammation, being a process, has multiple outcomes depending on certain factors. These factors are nature and intensity of the inflammation, site and tissue affected, responsiveness of host. And the outcomes possible are three based on these three factors. These outcomes are complete resolution, healing by fibrosis, progression of acute inflammation to chronic inflammation. Fourth possibility is abscess formation. So certain books mention it, although it's not so important to mention it. If you want to, you can in your exam. You can explain it using this diagram though, like the diagram I'm going to show next to you. Uh, right, so nature and intensity of inflammation. Um, so how big the inflammation here is, and yeah, it's just how bad the inflammation is, and it often depends on uh, how bad the offense against the tissue or the body was. Based on that, is how intense the inflammation is. Site and tissue affected, and also responsiveness of the host also determines how intense the inflammation is, obviously, and responsiveness of the host also determines how the healing takes place or the outcome of acute inflammation is. Site and tissue affected, where in the body, like what location in the body the inflammation is happening, and tissue affected, what tissue in that location is affected. Now, as we will move forward, you will see how this factor affects the outcome of inflammation. Right. So this is a diagram. It's really good diagram. You can see injuries. Sorry. So on the upper side of the picture, you can see acute inflammation. On the lower side, on the bottom, you can see chronic inflammation and what their morphological features are. For acute inflammation, it's vascular changes. All the vascular changes you learn in acute inflammation comes under this. Neutrophil recruitment, the major cell involved in acute inflammation is neutrophil, and the mediators, of course, cellular inflammatory, pro-inflammatory mediators I have to talk about, and coagulation factors also, and all of that. For chronic inflammation, you have angiogenesis. So instead of vascular changes dominating the picture, what will dominate, or something new you're going to see in chronic inflammation is angiogenesis, the formation of new capillaries in that area. Mononuclear cell infiltrate. Instead of neutrophils or polymorphonuclear cell infiltrate, you're going to see mononuclear cell infiltrate, which means you will have more of monocytes, macrophages, plasma cells, and monocytes and lymphocytes. Um, Fibrosis is the scar tissue. It's a deposition of collagen by fibroblasts. And this is the attempt at healing happening in the area of chronic inflammation. So you can see chronic inflammation, you can see tissue injury, and you can see attempts at healing all happening in one place where chronic inflammation is happening, which is not happening in case of acute inflammation. Like, you have tissue injury and you have inflammation happening, but you don't have healing happening at the same time. You can see the kinds of injuries that lead to acute inflammation. Now, it makes sense to think that any injury would start acute inflammation, but you have to remember that not all insults to the body start acute inflammation. Some of them directly start chronic inflammation. Okay. And now, coming to the outcomes of acute inflammation, we can see in this picture that acute inflammation progresses to certain results. Okay, acute inflammation can either end up in complete resolution, which you can see on the top right side. um, you can see that it's the same vessels, but they're not dilated anymore, and you can't see any cellular infiltrate there. It's just vessel and normal tissue around it, which you can't see, but that's what you have to imagine. Uh, so the idea is there's clearance of injurious stimuli, there is clearance of mediators and acute inflammatory cells, there's replacement of injured cells, and there's normal function of the tissue restored, normal structure and function restored. As for second outcome is abscess formation, which I was talking about, and the third outcome is healing again, but this is this is healing via fibrosis, where you can often see loss of function of that tissue. Fourth, in according to this picture, outcome is progression to chronic inflammation. So acute inflammation progresses to chronic inflammation. Now, in this picture, another thing you can see is that abscess and chronic inflammation will also eventually heal, and when they do heal, they will heal via fibrosis. Right. So the first outcome of acute inflammation is complete resolution. Now, what does resolution mean? Resolution means that there is restoration of the site of inflammation to normal. Normal means its normal structure and normal function. It starts, that is, complete resolution starts after elimination of the offending agent from the site of inflammation. Resolution is the usual outcome when the injury is limited or short lived, there is little tissue destruction, the damaged parenchymal cells can regenerate. And another important thing is presence of preserved extracellular matrix. All of these things, when they are present, acute inflammation heals via complete resolution, followed by regeneration, which is a type of healing process. So resolution and regeneration almost sound like they're synonymous, but resolution is simply, um, like we saw in the picture, it's clearance of the injurious stimulus or stimuli. It's clear, so removal of the offending material or offending whatever it is, removal of inflammatory cells and inflammatory mediators, clearing all of that out, removing the excess fluid in the tissue space by reabsorption of that fluid into the lymphatics, and replacement of the injured cells with healthy cells. And this is resolution. Once this cleaning up of inflammatory area is done, then healing can begin, proper healing can begin, and that is regeneration. So occurs by proliferation of cells that survive the injury and retain the capacity to proliferate. Example is in rapidly dividing epithelia, it is often seen regeneration and resolution of skin and intestine. So regeneration is often seen in rapidly dividing epithelia. I'm not saying resolution, I'm saying regeneration. Um, of skin and intestines. I've written intestines, but you can consider this to be GIT because in gastrointestinal tract, if I'm not wrong, like the whole epithelia is rapidly dividing. So yes, it stands true. Regeneration can happen for the entire gastrointestinal intestinal tract. In some parenchymal organs like liver, in case of liver, liver has regeneration capacity. That's what it means, regeneration capacity. So it can heal by regeneration. If you take a chunk out of healthy liver, um, for whatever reason, surgically you take it out, the rest of the healthy liver can regrow that chunk back. But if I was to talk about an unhealthy liver, for example, fibrotic liver in case of liver cirrhosis, then a big part of this liver is damaged, it's injured from fibrosis. So if we were to take a small chunk out of this liver from surgically, then this damaged liver would find it hard to replace this chunk back because it's not healthy. So, like we said, the damaged parenchymal cells should retain their capacity to regenerate. The injury has to be limited or short lived. There should be little tissue destruction. In case of liver cirrhosis, that's not the case. But if it was a healthy liver, we can have that. And that stands true for any kind of tissue, okay? Okay, moving forward. Yes. Second outcome is healing by fibrosis. Situations when this can occur. Okay, so first of all, what is fibrosis? I said that first possible healing method is regeneration. Second is fibrosis, okay? Regeneration and resolution are 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 like the top outcomes. They are the best outcomes possible. Healing by fibrosis, not really, but at least the tissue is getting healed, so that is good. Okay, so what is fibrosis? Fibrosis is deposition of collagen in the area of inflammation. So the area of acute inflammation, which is now moving forward towards healing, their healing is not by proliferation of the cells of that area, but it's instead by deposition of connective tissue, by like formation of connective tissue there, deposition of collagen there by fibroblasts. When does this happen? Certainly not optimal. So this happens when there is abundant fibrin exudation in the damaged tissue or in serous cavities. If the damage is in serous cavities or the inflammation happen in serous cavities, then obviously that cannot be adequately cleared. So the thing is not bare, but the idea is the exudation is so much that it cannot be completely cleared. When there is substantial tissue destruction or supporting structures of tissues are substantially damaged, like we said, extracellular matrix. So, okay, when inflammatory injury involves tissues that are incapable of regeneration. Example here is neurons, cardiac, and skeletal muscles. So, all these 3 points, remember them. They all, in all these situations, connective tissue grows into the tissue or exudate, converting into a mass of fibrous tissue. The process of deposition of collagen is called fibrosis and leads to formation of scar. Here you can see on the top set of pictures, on A, you can see this is a healthy skeletal muscle, and B, you can see that the light pink streaks in between. These are this is fibrotic tissue. This is all collagen, okay? In between the dark pink, which is the healthy muscle, the light is the scar tissue. On the top, sorry, on the bottom set of pictures, both are cardiac muscle, and on both of them you can see light pink areas in between, like um and you can see dark red areas. The dark red is healthy muscle, light pink area, this is all collagen, and in between you can see the fibroblasts, all these nucleophilic dots. You can see these are all fibroblasts and fibrocytes. Okay, so another point you need to remember is if fibrosis develops in a tissue space occupied by an inflammatory exudate, it is called organization. Example, as in organizing pneumonia affecting the lungs, of course, where fibrosis occurs in the alveoli. Alveoli is your space, tissue space. Um, Healing can occur by a combination of regeneration of some of the residual cells and scar formation, which actually happens often, that it's a combination of both. And this is a picture of organizing pneumonia. You can see a slide on which you have bit of lung tissue. And all these light pink areas you can see, I hope you can see my cursor. Light pink areas, circular areas, these are all collagen deposition in the alveoli and the surrounding lung tissue, which is darker pink. So this is all collagen with fibroblasts embedded in the alveoli. This is organizing pneumonia. And on a CT, it's gonna appear like this. Lung should not look like this on CT. These white splotches you can see in the lung, these are all fibrotic areas, okay? This is all fibrosis. It shouldn't be like this. So you will call this hyperdense areas on the in the lungs, in the lung area you can see on the CT. This is all fibrosis from organizing pneumonia. Yes. Third outcome is progression to chronic inflammation. A chronic inflammation is a response of prolonged duration, weeks or months in which inflammation, tissue injury, and attempts at repair coexist in varying combinations. Progression of acute inflammatory response to chronic inflammation occurs when acute inflammatory response cannot be resolved for whatever reason. Maybe an infection happened and acute inflammatory response was prolonged. Maybe there's persistence of injurious agent, maybe some interference with the normal process of healing. We can see this interference can be extrinsic, like an infection, or intrinsic to the injured tissue, and systemic or local. Local to the area of inflammation, or systemic, as in the whole body is affected. So, infection is one of the most common, important, and I would say common, not common, but like most, like the biggest cause of delayed healing. Another important cause is diabetes. It can compromise tissue healing if it's not well compensated. And when I write here uncompensated, or when I say not well compensated, I'm trying to talk about two things. One is uncompensated and one is decompensated. Uncompensated means that someone has diabetes and they're not on medications for diabetes to control their glycemia. And so uh, there is hyperglycemia on a in like a chronic situation, and that's causing damage to their microvasculature and macrovasculature, and that's causing improper perfusion to the area of wounds wherever inflammation is happening. There's poor perfusion, um, and that's leading to poor healing and increased risk of progression to chronic inflammation. Decompensated is the same thing. The only difference is that the person was on anti-diabetic medications, but they have either stopped taking the medication, or the medication is now not working well enough against the diabetes, and perhaps we need to increase the dosage. But the idea is the medication is not helping anymore, or they're not taking it. And so their hyperglycemia has come back because they still have diabetes and is doing the damage. So, not well compensated. Nutritional status has profound impact on healing. For example, protein malnutrition and vitamin C deficiency can inhibit collagen synthesis and retard healing. Glucocorticoids, example being on corticosteroid medication. Right. So it's important for you to know about the function of glucocorticoids and simply what effects they have on body. It's an important hormone, stress hormone. Um, Plus, it's important to know about the conditions associated with glucocorticoids. But a very important point why you should know about the effects of glucocorticoids is to understand the role of corticosteroid medication, which is basically an artificial glucocorticoid. In general, steroids have an anti-inflammatory effect on the body, plus they lead to formation of weak scars, which means that if someone has inflammation happening, you can't either give them corticosteroids, or if they are on corticosteroids, you must reduce the dose or do something about it. Mechanical factors. Right, so mechanical factors, they increase local pressure or torsion. Um, mechanical factors. Here we are saying that there is either increase in the local pressure in the area of inflammation where it's trying to heal, or there is torsion which can pull the wounds apart. Poor perfusion to the wound, like we talked about in case of diabetes. Foreign bodies in the wound, of course, it's bad because not only is there inflammation, but you put a foreign body there, somehow it reached there, and that's another foreign agent. So there will be again inflammation happening there. So there's a higher chance for it to lead to abscess formation actually with the foreign body there and progress to chronic inflammation, abscess formation. Type and extent of injury, like we discussed. Worse the injury, more tissues involved, higher the chance for chronic inflammation. Location of and higher the chance either for chronic inflammation or formation or healing by fibrosis. And location of injury again is important. Yeah, that's the presentation. Thank you guys.